I'm in the Dallas area along with Dr. Fahmi Farah, who's joining us now, one of North America's best-known cardiologists on the line with us. And, Doctor, always good to have you on the radio. And you have made cardiology your lifelong mission. Set this up for us, a little background about you. Welcome back.
Well, thank you so much, Willis. It's great to be back on your show, as always.
Well, looking at the cardiology medical arena, it is really quite fascinating, to say the very least. And I do want to make mention of the fact that it is important for drivers to be able to get out there and exercise in some way, shape, or form. If it's walking, if it's maybe riding a bike. I know many do put like a mini bike or a bike on their truck, and they maybe ride the trails and things like that. But over the course of the holiday weeks, maybe about a week or so ago, did I see a report that you have come away with the North American Ballroom Dancing Championship. Did I read that correctly?
You did.
Congrats.
Thank you so much. Yes,
great.
It's been a passion, and it was great to compete. Yes.
Oh, that's fun, and that's a good cardio workout, isn't it, with the ballroom dancing?
Oh, absolutely. It's very good cardio, and I always encourage people to stay active, doing what you love doing. Sometimes just going to the gym might be a little boring. Not to discourage anyone, but do what you love. And for me, dancing it just takes all my stress away. The 2 hours a day that I dance, those are the 2 best hours because I am completely out of this world, like no stress.
Oh, wow.
I'm just engrossed in dancing. So it's just like stress relief, cardio, it's all in one.
All right, absolutely. And what should drivers think about when it comes to stress? And the question I'm leading up to is that can stress take many different forms? What may be stressful for one may not be stressful for another, and depending upon that individual, can that complicate the cardio or cardiac situation?
It can. You're right. Stress is a very subjective thing. Something that's stressful for one person may not be stressful for the other person. So it is an individualized thing. Many factors stress us out. Job is a big one. Most people are stressed out with their work. And I'm sure drivers, it's no different. They're driving for hours. And so finding that outlet to let go of your stress is just so important. Whatever it is that's stressing you out, job-related stressors, those are difficult to get rid of because that's our livelihood. We have to do it. So we have to be able to mitigate that stress and find an outlet.
Yeah, drivers, let me open up the phone lines for you. I'd love to hear from you. Of course, Dr. Fahmi Farah is on board. How do you handle stress on the road? Do you look at stress and go, well, just take it in stride, or do you just kind of grip that steering wheel harder when the stress really starts to get to you? What do you do? Do you read? Do you like to maybe dance like Dr. Farah does? Do you like walking around the truck? You got a bike on board? That truck, give us a call. What is your solution, your remedy for alleviating stress? And again, the phone number, it's 888-876-2336 all across North America. Doctor, again, thanks very much for joining me on the program. Are a lot more companies realizing the importance of recognizing the stress factor in their employees, their workers, those on the front line?
Yes, I think employers really need to pay attention. I know, like in many workplaces, like hospitals, for example, they do give you modules to watch on stress management and stuff. But to be honest with you, those are not that helpful. We were actually just talking about it. A few doctor friends of mine that in essence, that actually stresses us out even more because that's an additional thing to do. Like watching a module on TV or on the monitor is not going to get rid of my stress. So really, my encouragement to everybody is it's individualized. It's your, it's up to us to find that outlet. And I'm going to go back to that. Employers do have a responsibility in the sense that not pushing the employees, to the point of stressing out. I know that we've become that way, definitely in the hospital settings, We just
Yeah.
need more friendly, more family environment where we pay attention to each other's health.
Now, do you find, doctor, that more and more hospitals are also recognizing the stress factors, say, with doctors and nurses? In other words, the stories of doctors working 36 hours straight or 24 hours straight, maybe that's kind of gone away in some cases. Maybe it's still there to some extent. But are hospitals recognizing the importance of helping their healthcare workers alleviate stress on the job?
I do believe that there's more awareness, there's more recognition that this is a problem. It is contributing majorly to the burnout factor among physicians. And so they recognize it. I think that's a huge step, but there's not a solution yet. So I do think that the hospital administration, they do need to come up with a better solution. And I think that's a multifactorial thing. That solution is not a one problem that can be solved and it'll be solved. I think they need to get down to the backbone of the problem. You mentioned like long hours. That's still there, especially for physicians. You take a heart surgeon, for example. Many of them are not getting any sleep in a 72-hour period because they're back-to-back in surgery when there's emergency surgery. So that's very much there. And I think it begins there, by beginning with providing more personnel, more help so that that physician can be relieved to take care of themselves. I think it starts with that.
Doctor, let me ask you this. Do you find that maybe some of those that are experiencing a high stress level that they may come down or think they've got like heartburn or indigestion, like maybe a pain that could be in the center of the chest area? Maybe some will grab like maybe an over-the-counter remedy to try to fix that. Can that contribute to things like that in your estimation? And how do you differentiate that between, say, the warning signs of a heart attack? Any difference here?
Very good question. You're right. So stress can contribute to what's called GERD. That's gastroesophageal reflux disease. And that is one of the symptoms, burning sensation in the stomach area and the chest area. And you're right, there's a type of heart attack where that can be very similar symptom. How do you distinguish that? One way would be, if it is a heart attack, it'd be a very profound kind of indigestion symptom. It's not your normal indigestion at all. And you'll also have shortness of breath with it. Most people describe it as they just can't catch their breath. They feel like something's sitting on their chest. You'll also have profuse sweating. Those are the distinguishing factors between a bad heartburn versus a heart attack. But to go a step further, I will say that for the most part, people have, general public will have a difficulty distinguishing that. So my advice would be to not try to do that yourself. If you're having symptoms like that, I would say seek help.
And, of course, if it's that severe, pick up the phone and call 911, right?
Exactly, yes. Call for EMS.
Okay, very good. Drivers, again, join us. Dr. Fahmi Farah is on with us. And, Doctor, again, thanks very much for joining me on the program. It's interesting. We are in this day and age where a lot of people will simply just try to go to the store and hope for the best and keep their fingers and toes crossed that the over-the-counter remedy that they're buying is going to solve the problem. And a lot of times we've got a lot of fancy advertising on TV that's out there showing the benefits of it. But it's really very important that if someone is having maybe a recurring situation with what you said, like you mentioned, GERD, get in to see the doctor. Let them be the guide. Let them show you what you need to do. Could be much deeper than simply an over-the-counter remedy, right?
Yes, I agree. It's try to not help, remedy on your own in those scenarios. I would say try to get help because time is life when it comes to these things. If it in fact is a heart attack, the timely treatment is so crucial to your survival, and not just survival, but to prevention of complications down the road.
Dr. Fahmi Farah is on with us, one of North America's most recognized cardiologists on the phone with us. And, man, it's all about keeping that heart going. Doctor, thanks very much. Where can folks find you up on the web and read about what you do? What's your website?
People can find me at www.drfahmifarah.com. Also on my social media, Instagram and Twitter at Fahmi J. Farah.
Okay, very good. Thank you very much, and really appreciate you doing this. You know, when somebody is going through a medical procedure like involving the heart, the person might hear things, terms such as ablation, or maybe atrial fibrillation. And again, Sheila wrote in a few minutes ago prior to the break. She just writes that her husband is going to be undergoing an ablation. No further information from that, but what exactly is an ablation? What is that?
Ablation is an invasive procedure. It's where we go in and, to be frank, we actually go and burn a part of the heart to prevent a type of rhythm problem from occurring. There are many different types of ablations for the different types of rhythm problems there are. You mentioned one, atrial fibrillation. That's a very common type of rhythm problem. So yes, there are ablation procedures available for that, where we go in and basically burn off an accessory pathway if there is like an abnormal pathway for electricity that exists in the heart that's responsible for creating that abnormality in the rhythm. Then by doing the ablation procedure, we cut off that area and allow the heart's normal rhythm to proceed, and that's how it usually resolves that problem. Some of the other conditions that we do ablations for include ventricular tachycardia, people who have a lot of PVC. Those are like big heartbeats that can happen frequently. There's something called SVT, atrial flutter. So there are a number of different types of arrhythmias, and we have ablation procedures for all of those.
Now, you mentioned like a flutter. Is that where somebody maybe can actually feel their heart fluttering? What is that? What does that mean?
Yes. Anytime our heart's rhythm is abnormal, so the heart is a very regulated structure, and its rhythm is meant to be very regular. And that's the heartbeat, essentially. Like, it beats in a very regular pattern. But when that rhythm is not regular, it can have like irregular pattern, and that can present itself as palpitation, which is a fluttering sensation in our chest. And any one of these abnormal rhythm can give you that symptom. AFib can, which is atrial fibrillation, atrial flutter can, PVCs can, ventricular tachycardia, of course, can as well. So just by feeling that symptom alone of palpitation, you cannot distinguish exactly what you're having. You do need to go to the doctor, and they need to do the proper testing to figure out what type of rhythm problem that is.
Okay. You know, it's got to be, Doctor, I would imagine, a good time to be in cardiology because probably many of the techniques and surgeries that you're describing probably were not around 10, 15 years ago. Medicine has really advanced here, right? Increasing the survival rate of those that might be undergoing, say, cardiovascular problems. Talk about that.
Oh, you're absolutely correct. Yes. Technology is at its best right now in medicine, particularly in the field of cardiovascular disease. This is probably by far the most one of the most advanced, technologically advanced fields within medicine. Just to give you an example, back in the day, if somebody had a blockage, we would have to do an open heart surgery on that patient, but that's no longer the case. We rarely send patients for open heart surgery. Majority of the blockages are now fixed percutaneously, which means we don't have to cut anything open. We actually go through the wrist without making any cuts and fix that problem. So you can imagine from where we were and where we've come. It's fantastic. Technology is incredible, and it is life-saving, and we're doing that every day.
All right, absolutely. And a lot of the folks that you're talking to, Doctor, many do smoke, and some are trying. Some just don't want to give it up. I mean, I know it's a choice, but would you recommend for everybody out there listening across North America, if you are smoking, stop, please, because doesn't that contribute to major heart problems, difficulties later on?
Yes, I would encourage everybody who's smoking to please cut back and stop smoking. That's the best thing you can do for yourself. I know it's not easy, but it's not impossible. I've had so many patients who used to be chain smokers, and one day they decided to just cold turkey cut off, and that's the best way to do it, is what I do for my patients. Yes, but yes, it's just by making that one change, you can save yourself from so many things like heart disease, lung problems like, cancer, things like cancer. Quitting smoking is absolutely the right decision.
I would imagine somebody that says they have quit cold turkey, my goodness, what an incredible thing that has got to be, just to be able to stop like that. Do a lot of people just simply stop, or does it take a lot of time, like maybe wearing the patches or weaning yourself off of the cigarettes as you go along? How do folks do that, cold turkey? That's amazing.
We do, and I help people. We all do, all the physicians, we do. There are many people who need that support, and so if you've made the decision to quit smoking, that help is available. It doesn't have to be so bad. And there are patches, there are medications we can give to help you achieve that goal. But then there are patients who are so brave, and they tell me that they just quit. And those are the most successful ones, by the way, in my experience.
Wow.
All my patients who've told me, they initially tried all these other measures, and one day they just quit, and that was it.
Wow. That was yeah. Oh, that's amazing. And you mentioned the nicotine patches. If somebody is prescribed, say, a nicotine patch, do not smoke as well. If you do both, are you looking at major issues when you're doing both?
Of course, smoking with or without nicotine patch are both bad. So I didn't know that wearing nicotine patch and smoking at the same time would cause more damage, more than what smoking is already doing. So probably not.
Okay.
But part of the reason for that nicotine patch is to, you have craving. It's an addiction. So the nicotine is what creates that craving. So when you're wearing a patch, your craving's going to go down. That's the whole mechanism behind that. So, and that's how people are more successful in quitting with those help, because you're just not going to be wanting that cigarette as much anymore. And so you really got to be aware of that and take advantage of that.
All right, absolutely. And again, bottom line, the sooner somebody does stop smoking, the better it is for their heart. And I've got about a minute left, Doctor, and when somebody stops, they make the decision to stop, in some way, is the heart like self-repairing? Does it change when you do that, when you stop smoking?
It can, yes. We say healthy diet, exercise, quitting smoking, all of that in the long run, it does help. To distinguish, if somebody already has some amount of blockage built up, usually that does not go backwards on its own without some kind of medication or intervention. That being said, you do yourself so much good by quitting smoking, because you can give yourself years of life just by doing that.
All right, absolutely. Gets down to the quality of life. Dr. Fahmi Farah on the line with us for her weekly visit. And, Doctor, we will do this again. Thank you very much